Hey there, my name is Cloud, and this is me enjoying my runs and the best gifts of life with my ladies. You can say I'm passionate about running. Welcome to my channel dedicated to recovery, rehabilitation, and running. Thank you for joining me in this journey to recover from the big C and hopefully one day soon run again. Alright, timelines. But before that, the program today is very simple. It's low cardio output that I'm still pursuing. I am here. I'm working out on my machines and getting my recovery program and recovery mode hat on for today. So basically, the plan today is a 24-minute session. Each station I'll be doing 3-minute intervals. Again, cardio pace of 120 maybe. Try not to spike my heart rate more than 130 because I'm still dealing with this tachycardia. The past 2 weeks that I've really noticed this spiking more so. Even at rest, I'm usually at about 110 beats per minute, and when I'm up and about walking, I'm spiking to 120 beats per minute. Although it does go back down to like 100 if I just sit still or lay down, maybe 90 even. So it does quickly recover. It's just kind of concerning. Anyhow, I'm ranting. Session and keeping a close eye on my heart rate as I work through these cross-training session today, and most likely I'll be sticking around and doing this program for the foreseeable future, and maybe for joining me in my journey to recovery. I hope that you're gonna tag along and recover with me and rehabilitate with me. Now, timelines. So for today, I actually ended up seeing my my cardio doctor, doing a EKG and a 2D echocardiogram, and it all came back normal. So I'm very happy to say that my heart is in really good tip-top shape. I guess that the heart is normal, everything is normal, the size, the shape, the pumping capacity, the valves. It did say that some of the valves are mildly thickened, which is normal for my age, but everything is normal. You know, the anatomy, the location, the pumping capacity. EKG, the electrocardiogram also yielded normal results. Nothing eventful to report. The peaks in the numbers, the sinus rhythm, they're all indicative of a normal functioning heart. So yay! I'll take some good news, definitely. So the heart is doing fine, and that doesn't mean to say I'm still having my tachycardic events throughout the day. But it is much better though, I have to say. The last 2 or 3 days, I've noticed a shift. I'm not spiking 120 as much when I'm walking. I'm keeping 110 when I'm up and walking, and I'm keeping 100, maybe 95 when I'm sat doing office work. And typically when I'm laying down watching a show, it's an even 82, 85 beats per minute. My blood pressure has also been decently stable. In the mornings when I take it, I'm usually 119, 120 systole. That's the top number. And the bottom number, I'm about 78, 82 diastole. So some would say 120 over 80 is kind of like the normal blood pressures. And I'm kind of right there in the mornings. Towards midday, I do elevate. I've noticed I'm at 132, maybe 136 over 85 or 89. And I've been kind of noticing that the past 2 or 3 days. To getting through and getting back to this program of recovery and rehab, and hopefully to running into really soon. But for now, since the weather has changed, indoor it is. So timeline wise, today is effectively, actually today is 4 weeks exactly since my my chemo. It's been 4 weeks since my first chemo infusion, and I've gone through I guess you could say hell and back at least for me. And and I understand that some people's experiences have been a lot milder, and some have been worse, being hospitalized and all of that stuff. So I'm thankful that aside one ER visit and this heart test that I had to undergo, in the grand scheme of things, my experience with my first chemo would probably be somewhere at the middle of those two scenarios of being unaffected by it, as opposed to being severely affected by it, requiring a hospitalization. And I know certain family members of mine in the past who've had to undergo chemotherapy, their experiences were a lot more worse, a lot more horrible than mine, as they have shared with me, to the point that they were required to stay at the hospital post their chemos because of severe reaction and debilitation from the infusions. So that's kind of where I'm at today. So I go back to this program, and I'm gonna try to string more of these activities, slowly and delicately ramp up my intensity, and the things that I'll be doing over the subsequent days, the subsequent weeks, and hopefully when the weather changes, or the season changes rather, I can get back out there doing what I love the most. I don't hate doing this work, by the way. I also enjoy being down here and working through my cross training. I do watch the TV, I do listen to music, and one of the things that works for me is I keep each station 3, 4, maybe 5 minutes. I don't stay on one station too long. I find that if I stay at each machine longer than 5 minutes, I end up getting bored, and I end up being discouraged. So I would sooner do higher intensities and increase the resistances on the machines, and rather than increase the minutes, to be honest with you. Because then by breaking each work on each station, on each machine, I don't get quite as bored, and I actually stay motivated. Plus I get the benefit of having a windbreak to catch my breath as I move through each of the machines. And then the motions are uniquely different, from the elliptical going to the row machine, doing some light resistance training. And by the way, the dumbbells that you see me lifting is adjustable by weight. And right now, last week I started with 15 pounds, and right now the weight on each dumbbell that I'm carrying is really only 20 pounds. That's kind of really not all that heavy. And I suppose that's a good place to be at, post recovery, post surgery, because the doctor did say, my surgeon did say that 8 weeks rather, to really remove any lifting precautions. So, and actually today is officially 10 weeks following my surgery. So 4 weeks excuse me, sorry, 4 weeks post chemo and 10 weeks post thoracic surgery with the removal of the lobe of my lung. So again, I do like the shorter minute sessions, and gradually increase the resistance as I progress, keeping a close eye on my heart rate. So that's it for today. Thank you for listening to my journey. I hope and pray that yours is moving along as well, even better than mine. And if it's not, let's work on it. Let's keep being positive. Let's stay guarded. Let's do this. We got this. Have a great day. Thank you.